Hey y'all, it's Medicinal Mackenzie and Naturally BC, and we wanted to talk today a little bit about some myths regarding naturopathic medicine.
Oh yeah, and there's a lot of them. I think this is something
We literally
that
have a list right
yeah,
here.
and we could come up with 100 more and do a
5-hour-long podcast, but we're not going to do that to you because that would be rude. So, the reason that we wanted to talk about this is because not a lot of folks who are currently in naturopathic medicine are talking about what it's like to be in naturopathic medical school. That's what our next video is going to be about. And working to accurately dispel some of these myths because we don't want to perpetuate them. And we want y'all to be informed. So, let's begin. One of the first and most common myths about naturopathic medicine is that naturopathic doctors do not use pharmaceuticals. Which is BS, because we totally do. We're trained as primary care providers. So even if we're not doling out the meds, people are still coming into our offices on these medications, and we need to know how they interact with herbs and how they interact with other modalities, how they interact with other medications, etc., etc.
I think the big difference is that we are fully trained and understand how to use pharmaceuticals and use them when appropriate. And it's one of those things that we see pharmaceutical intervention as a great option, but as kind of like, let's try what we can before we get there.
Yes.
And then when we need to, or if it's an emergency, or like if that's really indicated for that patient, it's a great tool to have in your toolbox, but it doesn't mean that it needs to be the first and only tool for treating.
Exactly. And we have this little pyramid that we talk a lot about in our education. Oh, you have it?
Yeah, I do.
Which is the therapeutic order. And this is kind of the basis of how we're trained as naturopathic physicians. Oh my gosh, that's so beautiful.
Ooh.
Yes. And you can find it online anywhere. We'll also post a reference to this as well. But the first thing is to establish a foundation for optimal health. And then at the top is pharmacology or synthetic drugs after trying herbs and whatnot.
Right, and surgery and things like that. Like higher force interventions, they're there. We know how to use them. We know when it's appropriate. But maybe it's not the first thing that we try.
We have a lot of other modalities that we're trained in, which we'll talk about in our next video when we try to talk about what it's like to be in naturopathic medical school.
Mm-hmm.
We won't get into it here, but there are so many options for every single patient, and the first resort does not have to be pharmaceuticals. It might be. The patient might need it. We were just talking about that, but there's a time and a place for it, and I think that that's really important to be able to recognize and seeing in the person in front of you.
Oh, yeah.
What's our next myth?
So this was actually something that came up when I was at an integrative dermatology conference. I was talking with an MD and another naturopathic medical student colleague of mine, and they were saying that they were worried about our education, and they were like, oh, I wish you guys were legitimate and had, like anatomy lab and some other, like what they felt were legitimate ways to learn certain modalities and subjects. And we were like, oh, yeah, like we have anatomy lab. Like we have, everything that's, quote, normal medical education. Like we do that and we have that. And we have 2 years of basic science training and things like that. Like we have biochemistry and anatomy. It's like, so that was something that is, I think, confusing, and like people worry about that with our profession because they're like, well, like we don't really know what you're learning. We don't know if you're like understanding the body.
We learned so much about the freaking body.
Oh yeah,
we're like experts, y'all.
So we do the basic sciences. We have anatomy and physiology and biochemistry and microbiology and immunology and just like allopathic medical school, like we go through all of those classes and we're tested in all of those subjects, and that's a really easy thing like that we can link to because there's differences. Like we have, how many hours of this that we do and how many hours of that, and the curriculum is, very easy to just look at. But that's something that I feel like people don't really know or understand or don't have the time to go look up, so they just assume that we're just kind of in the garden all day every
Twiddling
day.
our thumbs for 4 years or something. I don't know. Yeah.
Like, oh no, we had cadaver lab. We'll never forget cadaver lab.
Yeah.
But
and we were taught cadaver lab and anatomy by an ex-trauma surgeon who's a DO. Right. So there's not a lot of just straight up nepotism going on where we're only learning from NDs. Like we learn, right. I believe in referrals, like to a specialist, but also like having those people come in and teach us their specialty too. Right. Like that's how we're learning and integrating in our cardiology block. We have cardiologists coming and talking to us, and then we have the naturopathic cardiologist who is teaching us and integrating on so many different levels. Right.
We have like a PharmD come teach us pharmacology, things like that. Like we fully accept that there are other people that have a specialty and an education in that that should be teaching because they're the experts.
Exactly. So who are your experts, and learning that is important. Our next myth is that we are quacks. We are not quacks. We're like super normal.
We're not ducks.
Yeah, and
we're super normal.
We also have the capacity to be as quote unquote woo or non-woo as the patient wants us to be, which I think is a really amazing skill that doesn't get enough credit. Because we meet the patient where they're at in their health journey, and for some folks that is more spiritual or more mindfulness or those kinds of like esoteric fringe things, but for other folks it's not. And we don't treat every single patient like that.
Yeah, either. And I think I really respect that about our profession is like we have a wide range of people in it. So it's not like, and that's the thing is you should find a doctor that aligns with your own health philosophy too. So, if you're seeing someone and you're like, oh, like they're really not getting me or this is not right, like I know people in my profession, I'm like, oh, you would connect way more with this person. Like, because you, like, they're more spiritual or they're more into, like, energy medicine. Mm-hmm. And then I know that there are other people in our profession, who aren't trained in energy medicine
or it just doesn't float their boat, so they never got into it.
Right. So it's one of those things where it's like, to blanket the whole profession as one and put us all in a specific box, like, just doesn't fit anymore.
No.
And
that's like so 2000. We don't do that anymore. It's 2020, people. And then the next one is that we don't have a graduate degree, which is crap because we totally do. Like, let's talk about our educational background here for a second.
So I was on an airplane not that long ago, and I was talking to someone, and I was kind of explaining what I do, which is a whole conversation, and you need a few hours of a flight to get into it. But at the end, he was like, wow, like, so what year are you? And I was like, oh, like I'm in my third year. And he was like, so you're a junior? And I was like,
no,
nah, not really. And he literally the whole time I was talking to him, he thought I was in college. Like he thought I was doing my undergraduate degree in naturopathic medicine. And I was like, oh no, like, no, I went to the University of Arizona. I did a 4-year degree in nutrition. I had a minor in psychology and biochemistry. I took a year off. I applied to schools. I got a ton of patient education. And I actually worked in an elementary school as a health coordinator, which was an amazing opportunity. And then I started Naturopathic Medical School, and it's a 4-year graduate degree that requires you to have a bachelor's degree before you even start.
Exactly. And I have, oddly enough, we have a similar educational background. I also have a degree in nutritional sciences and then a minor in women's studies from Michigan State University, the residential Lyman Briggs College of Michigan State University. And then I also took a gap year, and I was a phlebotomist and basically like a CNA for patients with traumatic brain injury. And so I also spent an entire year having patient contact and clinical experience, which was huge and has been so helpful.
Yeah.
But I'm not an idiot, and I'm also very hardworking, and like this is what I'm passionate about. And it's going to be 8 years minimum education post high school, and then also residency, fellowships, or whatever that looks like for us after we graduate as doctors.
Right.
So, and also the reality of being a physician is that we will never stop learning, ever.
So when we're talking about like what residency looks like for us, so we talked about, you need your bachelor's degree, and then you go through a 4-year naturopathic accredited program, and that's important. We're going to talk about that in the next video. But then residency. And this is a really interesting topic for us because it's pretty accepted, like in the allopathic medical community, you do your medical school and then you match into a residency program, and that's 3 years. And then if you want to further specialize, you do a fellowship, all these different things. And for naturopathic doctors, people kind of feel like, well, is that required? Is it not? And basically, residency is not required except in the state of Utah. But we all want to do a residency, and the issue is funding.
And if we were federally funded, we would have more residency opportunities, although I know that the MDs and the DOs have limited residency opportunities as well, and this is a huge issue for them too. But to continue our training and to continue our learning and get some exposure and real world experience is huge for us. But the dichotomy within our education right now, where there's the older naturopathic doctors and then us, the newer generation of naturopathic doctors who are yearning and really like gunning for the residencies compared to those who kind of feel like we don't need it, is just an interesting, I don't even know what we want to call it, interaction or evolution of how we're evolving. And so it'll be interesting to see what happens in the next like 10 years or next 5 years with residency, and if we can somehow get that federal funding and just have more opportunities, and bring more awareness to that. But I do think that the residency is invaluable.
Yeah, and I think a lot of us feel that, the big fear is that after 4 years, you don't know what you're doing, and then you're just released into the world without any further training. And I think we are very well trained in school and during those 4 years, but I think we would all really appreciate a residency and having that additional training and that oversight. And the programs are growing. I know there's even specific people at our school who are like traveling to find different residency sites and open up those programs for us. But, when the whole residency program is being privately funded, it just makes that a more difficult sell than if the federal government is paying the hospital to hire residents and train residents. And those programs are set up and paid for by the federal government, where in our case, everything has to be kind of privately funded. So you have to work that out.
So right now we're currently licensed in 22 states and the District of Columbia and all the U.S. Virgin Islands. And so I think that when we see licensure in all 50 states, where we're getting that recognition in all 50 states and then some, that is when we might be able to see some changes in residency funding and becoming more like federally recognized. Although our institution is federally recognized because it's a university, we get federal funding in that aspect when we switch from college to university, but it's just this odd limbo that we're currently in right now. And I'm pretty sure that the DOs also experience this in the beginning or the advent of their upcoming as medical doctors too.
Yeah, and it's a little difficult because, one of the big arguments against us for licensure is that we don't do residencies. And we're like, all right, well, like, help us, find the funding. Like, let's get recognized. Let's do this. Let's do the residency programs. But then if we can't get, that national recognition and then potentially that funding,
we're just waiting for all the pieces of the puzzle to finally come together.
Exactly, yeah, it's like a puzzle that needs to just... That's slowly getting assembled.
So to be continued.
Exactly.
So, like this video, subscribe to our channels. Again, I'm Medicinal Mackenzie, and this is Naturally BC. Yes, follow us on Instagram and Facebook and all the things. And take a quick peek at our next video, which is going to be about what it's like being in naturopathic medical school.